Selection of the dissolution test apparatus is crucial in the dissolution method development. The selection of dissolution testing apparatus depends upon the formulation design. There are various dissolution test apparatus available. These are given in the USP and other pharmacopoeias. USP provides 7 type of apparatus, and each apparatus has specific features. Dissolution testing is a testing which evaluates the drug release from the dosage forms. Dissolution testing is an in vitro test, and it is a performance test for the formulation. It provides valuable information about the in vivo behavior of the formulation. Dissolution testing is critical quality control tool, and it impacts the formulation development, regulatory approval, and the post-approval changes. Also, dissolution testing provides valuable inputs for the in vivo drug release or dissolution of the formulation, and also it helps for the SUPAC. Apparatus selection impacts data reliability and regulatory compliance. USP General Chapter 1092 with the title The Dissolution Procedure, Development and Validation provides the valuable information about criteria for selection of the dissolution testing apparatus. It provides guidance on developing and validating dissolution test methods for different formulations or dosage forms, including the oral solid formulations. There are regulatory guidelines like USP is there, USP chapter 711. For dissolution, it provides official standard for apparatus and the test conditions. EMA guidelines are there, which provides the information related to modified release formulations, biorelevance, and their justification. US FDA guidelines are there for dissolution testing of the oral formulations. Generally, from all these guidelines and general chapters in the USP, you can understand that IR formulations are tested using apparatus 1 or 2, that is basket apparatus or paddle apparatus, while ER formulations can be tested with different apparatus like USP 1, 2, 3 or 4, and it requires justification for media selection, and it is emphasized on the IVIVC. Then see the apparatus and their common uses. Apparatus 1, it is basket apparatus, commonly used for the capsules and tablets, also some of the floating formulations which float in the media. So in basket we need to keep them and perform the dissolution. Apparatus 2, it is paddle apparatus. It can be used for immediate release, modified release, and for some of the non-floating formulations. Apparatus 3 is called as reciprocating cylinder. It is used for extended release formulations and delayed release formulations. Apparatus 4 is there, called as flow-through cell. It is used for the poorly soluble drugs. And apparatus 5, 6 and 7, these are used for the specialized dosage forms like transdermal, stents, implants, and some other formulations. Topical formulations are also tested using this type of apparatus. But for oral formulations, apparatus 1, 2, 3 and 4 are generally used. Apparatus selection by dosage form. So apparatus selection depends on to the formulation design. Generally IR tablets, these are tested by apparatus 2, that is pedal apparatus. IR formulation like capsules, which may be the gelatin capsule or HPMC capsules, are tested using the basket apparatus. Floating tablets are tested using basket apparatus to prevent the floating or surfacing. ER formulations are tested with apparatus 2 or 3. Delayed release formulations can be tested with apparatus 3 or 4. Many of the time, apparatus 1 and 2 can be used. Poorly soluble drug formulations are tested using apparatus 2 or 4. Sometimes apparatus 3 is also used for non-disintegrating type of formulations. Multiparticulate systems can be tested with apparatus 1, 2 or 3. US FDA has some guidance provided to the applicants on testing of the IR and ER formulations. IR formulations prefer paddle apparatus, that is apparatus 2, use media volume of around 500 or 900 ml and paddle speed 50 to 75 rpm. For ER formulations, apparatus 1 or 2 or 3 can be used and multiple time point sampling should be there. Apparatus and media choice must be justified. FDA emphasizes on biorelevance, discriminatory power and the IV/IVC. Mainly these are required for the extended release type of formulations. EMA guideline highlights apparatus 1 and 2 for the IR formulations and 3 and 4 for the modified release formulations to simulate the GI transit. Use of surfactant media or flow through cell apparatus can be used for the formulations containing low soluble API or poorly soluble APIs and for some of the soft gelatin type of formulations. It requires justification for apparatus media based on the product profile. Media and testing conditions. So standard medias are pH 1.2. You can get it by making the point of normal HCl. pH 4.5, generally it is acetate buffer, and pH 6.8, it is generally phosphate buffer. Volume are typically 500, 900 or 1000 ml. Surfactant may be used if the API has low solubility and the temperature is maintained at 37 degrees Celsius. Regulatory justification points are there, like demonstrating the discriminatory power, ensuring the biorelevance and the IV/IVC, and justifying based on the dosage form behavior, address the robustness and reproducibility. So all these points are required to be considered whenever the dissolution test apparatus is being selected. Additional considerations, you can have this information from USP chapter 711, that non-compendial apparatus may be used and justified with the data. Mesh size can be changed. Generally 40 is the mesh size for the basket apparatus, but you can use 10 mesh size, 20 mesh size or 80 mesh size depending on to the requirement, and you need to justify that change. Uniformity and dimensional compliance are required for the apparatus. Examples of these non-compendial apparatus are mini paddle or mini baskets for the low dose type of formulations. Rotating bottles, dialysis tube for the microspheres can be used. Modified flow through cell apparatus for some of the formulations like stents. The dissolution apparatus to be selected considering the formulation design and the release profile. Apparatus selection must align with the formulation and the regulatory needs. Generally, as per my experience, apparatus 2 paddle is used 90% times for the IR formulations. Some of the ER formulations utilize basket apparatus, and capsule formulations are generally tested in the basket apparatus. Use compendial apparatus whenever possible. Provide scientific and regulatory justification when deviating from the standardized apparatus. Tailor media and apparatus based on the drug solubility, release profile and the target market. Supports method development, regulatory filings and product robustness. As per my current understanding and knowledge and experience, whenever you are going to develop a dissolution method, consider the product as a global product or global market product and go through all the required guidelines and then select the apparatus. Always have data from two different apparatus for the test formulation and also for the reference formulation. Generally, you should perform dissolution testing on 12 units so that you can get clear idea whether to go with the same apparatus or whether to go with different apparatus. That means always have 12 unit data for the RLD or reference formulation and the test formulation in different apparatus. Then only you can finalize the apparatus and it will have scientific justification. If at all you need to use, for example, apparatus paddle type 2 for the capsules, then you can use sinkers as well. Also, you should try basket apparatus for the capsule formulation, and you should check the release behavior in the same media with the two different apparatus. So this will help you to understand the rationale and science behind selecting the dissolution apparatus. Thank you for watching the video. Let's meet soon with such kind of informative video.